Down.
Yes. We are now live on the Arkansas Minority Health Commission's Facebook page. We are going to give it a few minute or two so that people can start viewing this broadcast. Today, as you will be talking cervical cancer. The month of January is Cervical Health Awareness Month. And so we'll be doing a little bit of education on the topic today. We have Ms. Amanda Hunter with us from the Arkansas Department of Health. Thank you for joining us today.
Thank you for having me.
I do see a few people already on. Welcome.
Hey, welcome.
My name is Beatriz Mondragon, and I am the Mobile Health Unit Coordinator here at Arkansas Minority Health Commission. Welcome to the Let's Chat broadcast. And as I mentioned, today's topic is cervical cancer. And with us today is Miss Amanda Hunter. Miss Amanda, could you tell us a little bit about what you do and your job title and role at the Arkansas Department of Health?
Sure. My name is Amanda Hunter. I am the Program Nurse Coordinator for the Arkansas Breast Care Program. And what I do is I help ladies throughout the state of Arkansas to get into our program so that they can get breast and cervical cancer services for women that may be low income or uninsured.
Awesome. And just to start off, could you tell us a little bit about what exactly cervical cancer is?
Sure. Yeah. Well, cervical cancer is a cancer that will start out in the cervix. The cervix is the lower part of the uterus or a woman's womb. So that lower part, the baby will come out if you get pregnant. That one little part, that's the cervix. And so cancer are abnormal cells that will grow unusually on that cervix, and that's where cervical cancer will start. Cervical cancer, usually the main cause is through HPV or human papillomavirus. So that would be the main cause for cervical cancer.
And how is HPV exactly contracted or spread?
Sure. Human papillomavirus, HPV, is usually passed through sex. So just from one person to another through sexual contact.
Okay. And that's the only way?
Usually, yes. Mm-hmm.
Okay. And only women can get this?
Actually, men and women can get this.
Men and women can get this.
One person to another person, male or female, can be transmitted.
Okay. What is the statistic on, do you know the statistic on men versus women?
I'm not sure about the statistics, but I would, be safe either way, male or female. Want to, have practice safe sex and just make sure that that is a risk out there.
And who is at risk for cervical cancer?
Well, everyone that participates in having sex will have a risk of having HPV transmitted to them. If you have multiple partners, there may run a risk of having more risk of HPV. So.
And what are some ways that we can reduce that risk? Some prevention measures that we can take in order to reduce?
Sure. So there are additional risk factors for cervical cancer, like smoking. That's always tied to any type of cancer in the body. Also, like we said earlier, multiple partners, and then anything that would cause your body to not be able to fight off medical conditions like HIV. So what we can do to prevent that would be, of course, limiting your amount of sexual partners, and also, if you would like, you're thinking about it, try to reduce your smoking or try to quit smoking. But the way we can prevent cervical cancer is through regular screening tests. So a regular screening test will be two options. The Pap test is also called the Pap smear. And so the Pap smear will test those cells that are on the cervix to see if they're abnormal or unusual in any way. And then also the second test that will be offered at your regular screening visit will be the HPV test. And so the HPV test is what tests for human papillomavirus, which we've discussed that said it can cause those abnormal cells that lead to cervical cancer. I will also say that you can prevent cancer through the HPV vaccine. So if you're at a certain age, you can have the HPV vaccine, and that can prevent cervical cancer as well.
I'm sorry, I'm not sure. It kind of broke out a little bit. Did you mention what age would be?
Sure. With the HPV vaccine, it's recommended for it to start when you're preteens between the ages of 11 and 12, but you can get it as early as 9. It's usually up until through age 26. It's not necessarily recommended between the ages of 27 to 45, but if you are concerned about your risk of HPV, definitely talk to your provider about that and see if it would be beneficial for you.
Okay, so you would take it in your teens, and then you would
Yes.
go and that vaccine at age 26.
I'm sorry, I couldn't hear what you said.
I'm sorry. So you would, have that vaccine in your teens, 11, 12, early as that, but then you would also renew that vaccine at age 26.
Well, you can have it up to 26. So usually it's a 2-dose vaccine. So 2 doses if you're under 15, 3 doses if you're over 15, and you can have it up until the age of 26. So it's recommended for that age group. So 11 to 26. But after that, it's really just not necessarily recommended. But if you are concerned about that risk for HPV, definitely talk to your provider about it.
And when you say 2 doses, so it'd be 1 teens and then or up to 26.
Separate dose, yes.
Okay. All right. Um, could you tell us a little bit about how this actually impacts in the minority community?
Sure. So nationally, the CDC and the National Cancer Institute report in 2017 that Hispanics and also African Americans have a higher rate of cervical cancer diagnosis and cervical cancer death as compared to white women. And here in Arkansas, African women actually have a higher rate of cervical cancer diagnosis than white women. So ultimately, we just all need to make sure we get that regular screening so that we can, get early detection, as cervical cancer is.
Okay. So you mentioned the HPV screening and then the pap smear screening. How often should we be getting those screenings?
Well, it usually depends on what your results are. Normally, if you have abnormal results, it would be about every 3 to 5 years. But if there is something that the doctor is concerned about based on your results, it may be more frequently than that. So it's really just best to talk to your doctor to see what the best option is.
And at what age does the pap smear screening recommended to start?
Sure, it starts at 21. So if you're 21, you can start getting that pap smear. And if everything's normal, it may be every 3 years that you would get the pap smear.
Okay. Are there any signs or symptoms that of cervical cancer that someone should look out for?
Well, actually, early on in cervical cancer, you may not have any signs and symptoms, but later on, you may actually have some abnormal bleeding, which may be bleeding after sex, or painful sex, or if you have any vaginal discharge, it would be something that's out of the ordinary for use, or any watery or bloody discharge.
Okay.
But normally, signs and symptoms.
And going a little bit to the men's side, what exactly would like the screening look like, or the symptoms look like for them?
Men wouldn't necessarily have any symptoms. I guess for HPV, there may be some type of symptoms that they may have, but they can always get that checked out with their doctor for HPV symptoms.
And would that be considered a prostate exam, or what exam exactly would they perform on them?
For men, it depends on the transmission of where that may occur. HPV can be, it can actually be in the ear, throat, esophagus. It can be in the genital area. Like I said, it just depends on where that exposure was.
Okay. Are there any myths that exist about cervical cancer?
Well, I guess I would have to say, you know, maybe needing a pap smear every year. Like I said, if you're normal, you may not need it for every 3 to 5 years. And sometimes people may think that if they don't have symptoms, they don't need to have a pap smear or HPV test. But like we said earlier, early on, cervical cancer may not have any symptoms. So I think those are the main ones. Sometimes they think that it may be hereditary, meaning it's passed down by family members, and that's not necessarily the case. Cervical cancer is preventable with those regular screenings and also with the HPV vaccine.
Okay. Could you talk a little bit about the available resources that are out there for low-income patients?
Sure. So we work with the Arkansas Breast Care Program. And what we offer cervical cancer services for women starting at the age of 21 to the age of 64. And so if you have a low income or if you do not have insurance, you can enroll in our program and get, a pap smear. If there's something that comes back abnormal, you can get the follow-up test that covered under our program. And also, if you have insurance and you're low income, but maybe your deductible is high, we can try to work with you to get that follow-up test after the pap smear done as well.
Okay, so breast care is not only for breast mammography,
Exactly, yeah.
but it
So
also
we
includes.
offer, we do service
Awesome.
mammogram and then also for pap smears and any other follow-up after that. Mhm.
And can this program be used? Is it only to be used at the Arkansas Department of Health, or does any other doctor's offices take a breast care program help?
Yes, so we can offer it in our local health units at the Arkansas Department of Health, but we also work with private providers throughout the state. So your provider in our program already. So I would suggest everyone to go to the Arkansas Breast Care webpage, which is arbreastcare.com. And there's also a link there that says, how do I enroll? And if you click on that link, you can type in your county or a provider that you're interested in and see if they're already a breast care provider. But we have providers in each county, so there should be someone available.
Okay, and I'm actually going to put in our crawler, I'm going to drop down the website that you just mentioned and also the phone number. So it is
Okay.
breastcare.com, and the phone number is 501-661-2942.
Yes.
All right. Okay, so our arbreastcare.com, you can go and type in your address or zip code, and it will pull up a radius that includes where this program is offered. So be sure to visit this website, and also if you have any other questions or you have concerns or are unable to reach your questions on the website, you can call this number and they will be happy to assist you.
Mm-hmm. And also follow us on our breast care page, Arkansas Breast Care on our Facebook page. So if you want to get tidbits and information, you can also follow us on there.
Um, is there something else that you would like to point out regarding cervical health today?
Well, sure. I just wanted to, discuss as far as the pandemic, maybe people may not want to go out and see their doctor, but it's still, very important that we have our regular screening even during this pandemic. So I would, strongly suggest that we go out and make sure we get that regular screening, that pap test, HPV test, and also our mammograms.
Yes, and I also highly recommend for you to reach out to your doctor's offices and ask them what preventative measures they are taking regarding COVID, and you can prepare to attend your appointment and be as safe as possible. And so that you can get this taken care of. You can get your physical in, you can get your mammography or your annual pap, not annual, but your pap smear if it's time. It's really important for us to stay on top of our health, because prevention goes a long way, and to know about our health, and to make sure that everything is functioning properly and no abnormalities are happening. It's really, really important to um, to stay on top of things, to get that annual physical and things like that. Is there
cancer is preventable? Cervical cancer is something that we can prevent just through regular checkups and through the HPV vaccine. So
yes, so if you are about to be 26 or around that age and you haven't got your second dose of vaccine, make sure you talk to your doctor and see what they recommend and the plan of action to get that taken care of. Let's prevent what is preventable and make sure we get our health in order and stay on top of our health. At Arkansas Health Commission, your health is our priority. So if you have any questions or lose this contact information, you are more than welcome to give us a call, and we will make sure we get you the proper resource that you need, whether it's regarding cervical health or regarding your breast health or regarding anything. We'll make sure we get you pointed in the right direction. And we really appreciate everyone that has joined us today, and especially Ms. Amanda Hunter for taking the time to not come out, but join us virtually and make sure that we learn a little something this month regarding cervical health.
Well, thank you for having me. I've enjoyed it.
Thank you. And I hope you guys have a great day.
Have a great day.